All right, so get ready, everyone. Today we're taking a deep dive into something pretty fascinating, ICD-10-CM obstetric coding.
Ooh, yeah.
If you're thinking coding,
Yeah.
that sounds super boring. Trust me, you're in for a real treat.
Yeah, you'll be surprised.
We've got all sorts of stuff to dig into today. We've got guidelines, FAQs, even like a whole study guide. Looks like someone might be studying for an exam. But don't worry, we've got you covered.
Absolutely, we do.
To help us out, we'll be cracking open the Absolute Medical Coding Institute's Medical Coding Guidelines Manual.
The AMCI's MCG manual, yeah.
That's right. And you can actually find a link to that down in the show description if you want to follow along.
Awesome.
For this deep dive, we'll be focusing specifically on Chapter 15, which covers all things pregnancy.
All things pregnancy related, yes.
Exactly. So think like routine prenatal visits, or high-risk pregnancies, or even those tricky situations where there's like pre-existing conditions. We're going to be covering it all.
That's right. And we'll be zeroing in on those super important guidelines that every coder needs to know. These aren't just, random rules. They really ensure accurate documentation. And that's important for so many reasons: patient care, research, and even things like insurance reimbursement.
Okay, so let's jump right in. Chapter 15 codes. These are like the VIPs of pregnancy coding.
Totally.
So what's the golden rule when we're using these codes?
Well, the most important thing to remember is that Chapter 15 codes always come first,
Oh, really?
no matter what.
Huh.
It doesn't matter what other conditions are present. So, imagine a pregnant patient comes in and she has pneumonia.
Okay.
Now, even though the pneumonia might seem like the more urgent issue, we don't code that first. We always prioritize the pregnancy-related codes.
Interesting.
Yes.
So we're putting those pregnancy codes in the spotlight. Why is that so important?
Well, it all comes down to accurately capturing those unique parts of the patient's pregnancy journey. These codes, they help us track trends, they help us identify potential complications, and ultimately they help us provide better care for both moms and babies.
Okay, that makes total sense.
Ah.
So we've got those Chapter 15 codes front and center. What other guidelines should we keep in mind as we navigate this coding landscape?
One that tends to trip people up is the whole concept of trimesters.
Okay, trimesters, yeah.
The codes we use actually can change depending on which trimester a complication develops in.
Oh, wow.
And it's not about when the patient was admitted or discharged. It's really all about when that issue first arose.
So let me see if I get this straight. If a patient is admitted in her second trimester with preeclampsia, but the documentation says that it actually started developing in her first trimester,
Right.
we would actually use the code for first trimester preeclampsia.
Exactly. It's all about pinpointing the origin of each complication.
That's pretty tricky.
Yeah, you really have to look closely at the medical record.
Definitely need our detective hats on for that one.
For sure.
It's not just about knowing the codes, it's knowing how to apply them correctly in every situation.
Couldn't agree more.
And some of those situations can get pretty complex, especially when you're dealing with multiple gestations.
Oh yeah, twins, triplets, that definitely adds another layer of complexity.
Multiple babies. Okay, now things are getting interesting. So what special guidelines do we need to remember when we're coding for twins or triplets?
That's where the seventh character comes in. So certain Chapter 15 codes like 031, 032, 035, and 036, these codes actually have this special seventh character that lets us specify which fetus is affected in a multiple pregnancy. It's kind of like giving each baby their own little ID within the code.
So if one twin has a condition and the other twin doesn't, we can use that seventh character to show that, basically. Wow, that's incredible.
It is. It's super precise. And that level of detail is so important for accurate tracking and reporting.
It's not just like, oh, there's a complication. It's this specific baby has this specific complication. That's wild.
It is.
Okay, so we've got our Chapter 15 codes taking center stage. We're paying attention to those trimesters, and we're using our seventh character wisely for multiple gestations. What else do we need to know as we dig deeper into these guidelines?
Well, determining the principal diagnosis is really crucial. This is the condition that's mainly responsible for the patient's visit or their admission, and it basically guides the whole coding process.
Right, so for a routine prenatal checkup, we would use code Z34.
Yep, that's the one.
But what about those high-risk pregnancies that need more intense monitoring and stuff?
Good question. In those cases, we use code 009. This specifically addresses the supervision of a high-risk pregnancy.
Interesting. So even within prenatal care, we're already using different codes to match the specific needs of each patient.
Absolutely. It's all about being as precise as possible.
Now, what happens if there's a complication but no delivery? Like, let's say a patient is admitted for really bad morning sickness, but she doesn't go into labor.
Okay, yeah. In that scenario, the principal diagnosis would actually be the severe morning sickness because that's the reason she was admitted in the first place.
Makes sense.
It was the primary reason she needed medical attention.
Okay, that makes sense. But what if a delivery does occur during the encounter? How do we figure out the principal diagnosis then?
All right, so this is where things can get a little tricky. If there's a delivery, the principal diagnosis is the condition that led to the admission for the delivery. So it could be preeclampsia, gestational diabetes, or even just the start of labor itself.
It's like we're working backwards trying to figure out what led to that delivery.
Exactly. You got to think like a detective sometimes.
I bet there's one code we can't forget in these situations, right?
You're talking about the outcome of delivery code Z37.
Ah, yes, Z37.
This one's non-negotiable. It has to be included on every maternal record when there's a delivery, no matter what the principal diagnosis is.
Like the final stamp on the paperwork, basically.
Pretty much.
Okay, so to recap, we always start with Chapter 15 codes. We pay really close attention to the trimester.
Yeah.
We use the 7th character for multiples.
Right.
And we never forget Z37 when there's a delivery.
You got it. And let's not forget about the difference between pre-existing conditions and those that are caused by the pregnancy. That's where those Chapter 15 guidelines really come into play.
Oh yeah, good point. We need to be able to tell the difference between someone who, let's say, had hypertension before getting pregnant versus someone who develops it because of the pregnancy.
Exactly. And that's where accurate coding really hinges on understanding those nuances, you know. It's not just memorizing codes. It's about using those codes to paint a full and accurate picture of the patient's health history.
I'm starting to see the bigger picture here. We're not just coding for individual diagnoses, we're coding for the whole experience of pregnancy.
You got it.
And motherhood.
Exactly.
And those guidelines are like our roadmap to navigate all the complexities and ensure that everything's accurate.
Well said. So are you ready to dive into some real-life examples and see how these guidelines actually work?
Absolutely. I'm ready to put my coding knowledge to the test. How about you listeners? You with us?
All right, let's put those coding skills to work. Imagine a patient comes in. It's a routine prenatal visit.
Okay.
She's feeling great. Everything's progressing normally. Pretty textbook, really.
All right.
So what code are we going with in this happy little scenario?
Okay, let me think. Routine prenatal visits, those are coded as Z3D4, right?
Got it.
Encounter for supervision of normal pregnancy. Pretty straightforward.
Exactly. Now let's switch things up a bit. Let's say our next patient, she has a history of hypertension,
Okay.
but now she's pregnant. How would we code that?
That's where it gets tricky, right? We can't just assume that any hypertension during pregnancy is, pregnancy-induced.
Right.
We have to be careful to tell the difference between pre-existing conditions and ones that develop because of the pregnancy.
Absolutely. That's where those guidelines on pre-existing conditions are super helpful. So in this case, we'd use code O10 to show pre-existing hypertension complicating the pregnancy, and then we'd also add the appropriate code from that I-10 range to specify the type of hypertension.
So we're using multiple codes to get a more complete picture.
Exactly. Layering those codes like building a puzzle.
I like that.
All right, speaking of puzzles, let's try a tougher one. Imagine a patient, she's admitted to the hospital, 3rd trimester, and she's experiencing severe bleeding.
Oh.
Ultrasound shows that the placenta has separated from the uterine wall. It's called placental abruption.
Oh, that's serious.
Yeah, this is definitely a serious complication, needs immediate attention. So how would we code this?
Okay, well, it's definitely a pregnancy-related complication, so we need a Chapter 15 code.
Rick, sir.
And with all that bleeding, I'm thinking the placental abruption is the principal diagnosis, right?
Right on, you're on the right track.
Okay.
So the principal diagnosis would be placental abruption, code O45.
Okay.
And because this happened in the 3rd trimester, we'd get even more specific and use O45.93.
What's that one for?
Other abruption of placenta, 3rd trimester.
Oh, so we're not just coding the condition, we're coding when it happened, too.
Exactly. Got to be precise.
Now, what if this patient ends up needing an emergency C-section to deliver the baby?
All right, good question. What other codes would we need to add?
Well, first of all, we can't forget our friend Z37,
Of course not.
the outcome of delivery code. And since it was a C-section, we'd need a code for that too.
Exactly. We would use code 082 for delivery by cesarean section.
Okay.
And because the C-section was because of the placental abruption, we'd also include 045.93 as a secondary diagnosis.
So we're linking all these codes together, telling the whole story.
Exactly. The complication, the intervention, the outcome, it's all there in the codes.
Obstetric coding is more interesting than I thought.
It really is. It's not just isolated events, it's documenting this whole journey.
Like weaving a tapestry. All those codes are the threads.
Beautiful analogy. Now, what other tricky situations might we run into?
Ooh, good question.
Well, one that comes up pretty often is substance use during pregnancy.
Yeah, that's a tough one.
It's sensitive, but it's really important to code it accurately. We want to make sure both the mother and baby are getting the care and support they need.
So how do we handle those situations, while still being sensitive and ethical?
Well, the guidelines are clear. We have specific codes for documenting substance use, but they're never meant to be judgmental. They're just a tool to capture important information so we can make good decisions about treatment and support.
That makes sense.
Yeah.
So let's say a patient tells us she's been drinking alcohol during her pregnancy. What would we do?
Okay, so we would use code 099.31,
Okay.
alcohol use complicating pregnancy, childbirth, and the puerperium. And then we'd also include a code from the F10 range to specify the type of alcohol use disorder if it's documented.
Okay, what about tobacco use?
Similar idea, we'd use code 099.33 for tobacco use complicating pregnancy. And if the patient is dependent on nicotine, we'd add F17.
Gotcha. So again, multiple codes to really capture the nuances of this situation.
Right. Now, what if the substance use has led to complications for the fetus?
Oh, that makes things even more complicated.
Yeah, that's where codes like 035 and 036 come in.
Oh, wait.
We use those when a fetal condition is affecting how we manage the mother's care.
I see.
So, for instance, if a baby is born with fetal alcohol syndrome, we'd use code 035.4.
What's that one?
Maternal care for known or suspected fetal abnormality affecting management of the mother.
So even though it's a problem with the fetus, we still use a maternal code because it's impacting her care directly.
You got it. It's all connected.
I'm really seeing that connection everywhere.
It's a constant theme in obstetric coding. Always got to look at the big picture.
Okay, so we've talked about the pregnancy itself, but what about after delivery? Postpartum and, peripartum?
Yes. Those are really important periods, too.
They are. What special coding things do we need to keep in mind for those?
That's a great question. So the postpartum period, those first 6 weeks after delivery, it's a time of big changes. And then there's the peripartum period that goes from the last month of pregnancy all the way to 5 months postpartum.
Oh, wow. So it's a much bigger window.
It is. And during both of these periods, we need to be on the lookout for potential complications.
So we're still using those Chapter 15 codes even after the pregnancy is over.
Exactly. If a condition happens during the postpartum or peripartum period and it's related to the pregnancy, we use a Chapter 15 code.
Okay, makes sense. But what if something pops up outside of those time frames? Like, say, a patient has postpartum depression, but it starts 8 weeks after delivery.
That's a good question, and that's where clinical judgment really comes in. The guidelines allow for some flexibility there.
Okay.
So if the documentation clearly links the postpartum depression back to the pregnancy, even if it's happening outside that 6-week window, we can still use a Chapter 15 code.
So it's not just about the time frame, it's about the connection to the pregnancy.
You got it. It's about understanding the bigger picture. And that's why it's so important to really understand those Chapter 15 guidelines.
Right. They're the framework, but they're flexible when we need them to be.
Exactly. They help us capture the complexity of each patient's experience.
This is all so fascinating, but I have to admit, it's a lot to take in. Any tips for coders who are just starting out in this area?
Oh, absolutely. The AMCI's Medical Coding Guidelines Manual that we talked about earlier, that's a fantastic resource.
Yeah.
Really clear explanations, lots of helpful examples and case studies. And don't be afraid to connect with more experienced coders, too.
Oh, yeah. Good point.
There's a whole community out there who can offer guidance and support.
That's good to know.
Yeah.
Okay, before we move on, I want to talk about documentation for a second. We've been focusing on the guidelines, but the provider's documentation, that's pretty important too, right?
Oh, documentation. It's the foundation of everything we do as coders. We can't do our jobs properly without clear, complete, and accurate documentation from the provider.
So what are some things coders should look for in the documentation just to make sure they're applying the guidelines correctly?
Specificity is key. We need to see detailed descriptions of diagnoses, procedures, any complications. We need to know the trimester, when a condition developed, how severe the symptoms were, and anything else that's relevant to coding. Vague or incomplete documentation, that's a recipe for errors.
And those errors can really impact patient care and reimbursement, right?
Absolutely. So it's a team effort. Providers have to give us good documentation, and we have to carefully review it to make sure we're picking the right codes.
A true partnership, all for the benefit of the patient.
Exactly. Speaking of partnerships, let's take a quick break so our listeners can catch their breath. When we come back, we'll wrap up this deep dive with some final thoughts and explore the bigger picture of obstetric coding.
All right, sounds good. We'll leave you with a question to think about during the break. How do you think accurate and ethical obstetric coding can contribute to a healthier future for mothers and babies? Be right back. Welcome back, everyone. I hope you had a chance to really think about that question. How does accurate obstetric coding contribute to a healthier future for moms and babies?
It's a big question, and it really highlights the importance of what we do.
Yeah, it's more than just assigning codes, right? It's about telling a story that can actually impact people's lives.
Exactly. And when we get those codes right, it unlocks so much information. It can help us improve healthcare in a really big way.
So how does that work? Can you give us an example?
Sure. Think about researchers. They use coded data to track all sorts of things, trends in maternal health, risk factors for complications, that sort of thing.
Okay, yeah.
Accurate coding gives them a clearer picture of what's happening, and then they can use that information to make better decisions about treatment and prevention.
So it's not just about billing and reimbursement. It's actually about, saving lives.
Absolutely. It has a real impact on public health initiatives.
Wow, that's pretty powerful.
It is. And we've got to remember that technology plays a big role in all of this, too.
Oh, yeah, for sure. Things have changed so much.
We've come a long way from those old paper records. Electronic health records and computer-assisted coding have made things so much more efficient and accurate.
But that also means coders need to stay up to date with all the latest technology, right?
Right. It's a field that's constantly evolving, which keeps things interesting.
It's a challenge, but it's a good one.
Exactly. That's why continuing education is so important.
Always learning.
Always. Now, before we wrap things up, I think we need to circle back to those ethical considerations we talked about earlier.
A good point. We're dealing with really sensitive information, and we have to treat it with care.
Exactly. Patient privacy is paramount, and we need to make sure coded data is used responsibly.
And that we're being fair and inclusive in our coding practices, no bias.
Well said. It's about using our expertise to advocate for patients and promote ethical data practices.
Okay, I think we've covered a lot of ground today. What are some of the key takeaways you want our listeners to remember?
Obstetric coding is more than just a technical skill. It's about combining that technical knowledge with compassion and understanding.
It's about seeing the whole picture, the human side of things.
Exactly. And don't forget about those AMCI Medical Coding Guidelines. That manual is an invaluable resource.
Definitely check out the link in the show description if you haven't already.
It's like having a coding expert on call 24/7.
Well, that about wraps it up for this episode of The Deep Dive. We've explored those tricky guidelines, talked about the challenges and rewards of obstetric coding, and really looked at the impact this field has on the lives of mothers and babies.
It's been a great discussion.
Thanks for joining us. And keep those coding brains sharp. We'll see you next time on The Deep Dive.